Penguin Random House Audio presents Good Energy, the surprising connection between metabolism and limitless health by Casey Means, MD, with Callie Means. This is the author, Casey Means, MD. Note to listeners, this program includes a downloadable PDF, which contains Part 3, the Good Energy Plan, and Part 4, Good Energy Recipes from the book. You can access this PDF at caseymeans.com/goodenergy. For Gail Means. Born 1949, died 2021 of pancreatic cancer, a preventable metabolic condition. Introduction. Everything is connected. I weighed 11 pounds, 9 ounces at birth. My mom's doctors congratulated her for producing one of the largest babies in the hospital's history. My mom had trouble losing the baby weight and continued to battle her weight for years after. Her primary care doctor told her this was normal. She just had a baby and was getting older, after all. They told her to eat healthier. In her 40s, her cardiologist diagnosed her with elevated blood pressure. The doctor said this was very common for women her age and prescribed an angiotensin-converting enzyme, ACE inhibitor, to help relax her arteries. In her 50s, her internal medicine doctor informed her she had high cholesterol, or more technically, high triglycerides, low HDL, and high LDL cholesterol. She was prescribed a statin and told this was almost a rite of passage for a person her age. Statins are one of the most prescribed drugs in U.S. history, with over 221 million prescriptions doled out annually. In her 60s, her endocrinologist said she had developed prediabetes. The doctor stressed that this too was very common and not of much concern. It's a quote-unquote pre-disease, after all, right? And one that 50% of American adults qualify for. She left the office with her prescription of metformin, a drug that is prescribed over 90 million times per year in the United States. In January 2021, when my mom was 71 years old, she was taking her daily hike with my dad near their home in Northern California. Suddenly, she felt a deep pain in her belly and experienced uncharacteristic fatigue. Concerned, she visited her primary care doctor, who conducted a CT scan and ran lab work. One day later, she received a text message with her results: Stage 4 pancreatic cancer. 13 days later, she was dead. Her oncologists at Stanford Hospital called her pancreatic cancer unlucky. My mom, who at the time of her cancer diagnosis was seeing 5 separate specialists, prescribing 5 separate medications, was frequently complimented by her doctors in the decade running up to her diagnosis for being healthy compared to most women her age. And statistically, she was. The average American over 65 sees 28 doctors in their lifetime. 14 prescriptions are written per American per year. Obviously, something isn't right when it comes to the health trends of our children, our parents, and ourselves. Among teens, 18% have fatty liver disease, close to 30% are prediabetic, and more than 40% are overweight or obese. 50 years ago, pediatricians might go an entire career without seeing these conditions among their patients. Today, young adults exist in a culture where conditions such as obesity, acne, fatigue, depression, infertility, high cholesterol, or prediabetes are common. 6 out of 10 adults are living with a chronic illness. About 50% of Americans will deal with mental illness sometime in life. 74% of adults are overweight or have obesity. Rates of cancer, heart disease, kidney disease, upper respiratory infections, and autoimmune conditions are all going up at the exact time we are spending more and more to treat them. In the face of these trends, American life expectancy has been declining for the most sustained period since 1860. We are convinced that these increasing rates of conditions, both mental and physical, are part of being human. And we are told we can treat the increasing rates of chronic conditions with, quote-unquote, innovations from modern medicine. In the decades leading up to my mom's cancer diagnosis,
Sample complete. Ready to continue?